But again, one of your groundbreaking work was doing vagal nerve stimulation through surgery to help reverse autoimmune disease. I mean, one of your most well-known cases was that gentleman in, I believe, Serbia, who had severe rheumatoid arthritis, had failed all medications, and was essentially, homebound. And by having one of your implantable vagal nerve stimulators through surgery, it was an amazing reversal of his condition where he was out and about and back working, it's an incredible story for anybody listening to this, and really sets the stage for what I want to talk about in a few minutes. But just one last thing on this vagal, on the heart rate variability. I'm just out of curiosity, because I know you've looked at a lot of studies and done the work yourself. Do you see pretty significant changes in their vagal tone after these kind of patients have been treated with vagal nerve stimulation? Like before, their heart rate variability was minimal, and maybe now it's a lot more variable?
Again, it really depends on the device.
So, well, how did you guys measure it?
As of today? So we measured, my colleague Sangeeta Shivan and I at the Feinstein Institute at Northwell Health, we studied patients, healthy volunteers with no known autoimmune conditions, and we studied patients with rheumatoid arthritis at various stages. And in general, we asked patients to come into a study room and have essentially a 1 hour EKG. And
a 1 hour EKG,
still,
okay.
1 hour EKG lying still. And we did this many years ago, and we published it some time ago in peer-reviewed journals. And what we found was, in general, patients with rheumatoid arthritis, and there have been many, many studies, dozens of studies now done by groups all around the world. And the findings are highly consistent. Patients with autoimmune conditions, sepsis, serious inflammation from a whole range of underlying causes, they pretty much all have highly decreased heart rate variability, very low levels of heart rate variability. And this is consistent with the idea, the hypothesis, that impaired vagus nerve function is associated with increased inflammation, but it does not prove cause and effect. It's possible that the inflammation caused the vagus nerve dysfunction, which manifests as impaired or decreased heart rate variability. And it's possible that impaired vagus nerve function, which manifests as decreased heart rate variability, contributes or causes the underlying inflammation. But we haven't proved, no one's proved that in human studies yet, in clinical studies yet.